I was in a constant state of misery. The drugs were working for a little bit of time and then they'd wear off again. I'd finally come to the point where I acknowledged that the depression was a real thing, but I didn't think that there's anything I could do about it. I first heard about NeuroStar when I changed to a new practice. They had the device there in the office. I didn't think a whole lot about it when it was first suggested to me in my initial meetings, but a few months into working with my therapist, when I was getting to that point of desperation, not seeing a way out, she suggested that I take another look into it. At first, I dismissed NeuroStar as therapy, mostly because it was new and I hadn't heard of it. It was when my therapist got me to look at if I needed to make a change, that I started to look into it. And I admit one of the things that held me back, and I think is a fear for a number of patients right now, was the cost of going through the process. And my therapist said to me, you have to think of it as an investment. You have to think of it as an investment on getting the rest of your life back. This was a different technology. This was different science. It was the first actual alternative that I'd ever been presented with. And that's what made the difference for me, that this was a real change that I could make. And especially once I learned about how few side effects there are, really it seemed like the only thing that trying this alternative would cost me was just the time and the money. Initially, I really dismissed TMS just as being sort of the treatment du jour, just the new idea that the company wanted all of its patients to try. But it was my therapist who really pointed out that if I wanted to make a change, I had to do something different. And as I learned about NeuroStar and neuronetics and TMS, this was different. I couldn't believe that anything was going to work for me. I couldn't believe that even if the treatment is as successful as all the studies and reports say, that I would be in that huge percentage for whom it works. I would be in that small percentage for whom it wouldn't, because, of course. I was very convinced of this. Luckily, even at the time, I knew that that was my depression speaking. I knew that that was the disease itself holding me back from wanting to take this risk. The idea of leaving that misery that I was comfortable in, as much as it was misery, that was scary. This is a big change. And just overcoming that fear was in of itself a challenge. And I did have to talk with my therapist to work through that fear of change. When I was depressed, I could not hold a job. I could not make money. I was dependent on my family, on my loved ones. My goal would eventually to move that dependence onto the state. It was an economic decision that if I went through this treatment, I would be able to work. I would be able to pay for the treatment and then pay for all the other things that I wanted in my life that I could never have gotten for myself while I was depressed. During the first few weeks of treatment, I often wondered if this was working, could this work? I wondered if they were doing it right. When you're depressed, you can't feel hopeful. When you can't feel hopeful, you can't give trust. And I couldn't trust the treatment, the team, myself, the universe, anything that this was going to work. I was committed in a way to it not working, because that would then make me, would show that my view of the world that I'd had for 20 years was right. So there was an emotional part of me that almost didn't want it to even work. I was very, very reluctant to acknowledge its success. I didn't even know, as I was going through the process, that I was becoming more hopeful. I was becoming more able to accept that it was working because it was working. It had been the disease telling me that it wouldn't work. It had been the disease telling me that I was a failure. It was the disease telling me that it would never work. And as it worked, as my symptoms receded, I could feel hopeful again. I could acknowledge the good changes in my life. I could bring myself to see that it was working. My parents say that they noticed the change in me in as early as that first week. The woman who was actually administering it says that she noticed a change in me within that second week. But I was so committed that I was a failure and so this was going to fail, that it took me a fair amount of time after that before I finally was forced to acknowledge that, oh yeah, this worked. In the first few weeks of the treatment, my friends started noticing a difference as well. I was more pleasant to be around. My family noticed that I was sitting up straighter. I was more engaged. I was finding that I was thinking faster. I was thinking clearer. I was making decisions from a better, healthier place. Of course, because I still had some depression, I dismissed this. I thought it was just a good week. Yeah, I've had good weeks before. It was followed by horrible weeks. And so I didn't think that this was the treatment having an effect. The aha moment when it became clear to me was when I got out of the shower one day and I was just showered and shaved and I looked in the mirror and I thought to myself, oh, you clean up well. And it was like I was punched in the gut, like the wind came out of me. I grabbed onto the vanity because it was at that moment that I realized that I never looked at my reflection and said something positive to myself. I, in fact, had always looked at my reflection and said something negative. I had no idea that that's how depressed I was until the moment when I didn't do that. The things that I really want people considering going through TMS to know. First off, it worked for me. I know I have faith and hope that it can work for you. Your depression is affecting the way you think. Rely on the people who love you and who are there to help you. Listen to your doctors and your therapists. Believe in them. They know what they're doing. Listen to your loved ones. They care about you. And when you can't see your life for what it is because you're depressed, you have to let yourself believe and have faith in them. When they tell you it's working, believe them. When you go through the dip, when you have that moment of fear that this is going to be worse, it's not going to work, and they tell you that you can get through this and that it will get better and that you already are getting better, find that faith in them that they have in you because you deserve it, and know that this can really work. If I could go back to talk to my depressed self. I think that all I'd really say is don't wait. Don't hem, don't haw, don't waste those months. Go for the NeuroStar therapy. Just do it, make that change.